Welcome. My name is Peter Strong. I'm a professional psychotherapist and I specialize in online therapy via Skype. So if you're interested in Skype therapy sessions for healing anxiety or depression without using medications, then please contact me and ask any questions that you have. I'm happy to answer your questions. When you feel ready, we can schedule a Skype therapy session to help you learn the best methods available for overcoming anxiety or depression without using medications or other treatment protocols. It's much better in the end that you learn how to do this yourself, how to manage your own emotions more effectively yourself, without relying on medications or an external person to do that for you. So that's the whole emphasis of mindfulness therapy, which is what I specialize in and have developed over the years for treating anxiety and depression. It's about teaching you how to work with your emotions and how to promote emotional healing. That is a very significant theme in mindfulness therapy. It's really about how to learn how to change the relationship that you have with your emotional pain, whether that's anxiety or depression or anger or grief or guilt or addiction or obsession, whatever it might be. You have to change the relationship that you have with your emotions. If you run away from your emotions, that avoidance will simply reinforce those emotions and will not allow them to heal effectively. If you indulge in the emotions, if you identify with them, then that also will not promote their healing. And if you attach to your emotions, you grasp at them, believing that that's who you are, then that will also lead to the proliferation of that emotional suffering. So in mindfulness therapy, we train ourselves to be able to be totally conscious with our anxiety or depression, but without becoming identified with it, without becoming imprisoned by those conditioned emotional reactions. And we do this by meditating on the emotions itself. This is the primary focus of mindfulness meditation. Some people think that mindfulness meditation is about escaping your emotions and your thoughts and your mind. Nothing can be further from the truth. True mindfulness meditation is about becoming more mindful of the mind, of your experiences, your perceptions, your thoughts, your emotions, all of that. We need to become much more conscious of these and less driven by habit and unconscious reactive processes. So the best way to develop more conscious presence with the mind is to meditate on the mind. And that is mindfulness meditation. So if you are suffering from anxiety, you would deliberately meditate on that anxiety. You would find the situation that triggers that anxiety. You would find the thoughts that trigger that anxiety. And then you develop mindfulness in relationship to the emotion that gets triggered. In this way, we train ourselves out of that unconscious aspect of emotional suffering. That is the real problem, the unconsciousness that drives the conditioned habit that leads to suffering. So by meditating on our emotions and on the triggers, on the thoughts, on the beliefs, whatever it may be, we bring in that consciousness factor, and that begins to free us from the unconscious habit. When we can sit with our emotions without reacting, then we can proceed to help the emotion heal. So healing is central to mindfulness meditation. It's not just about becoming more aware. That's obviously the first step. But the most important process that we then engage in is to facilitate the healing of that emotional pain. You cannot heal anxiety if you're not present with your anxiety. But when you are present, conscious, mindful, sitting with your anxiety, then you can begin to look at its structure and you can begin to help it change and heal. All emotions are destined to heal. That is part of their very fabric, if you like. Emotional suffering is best described as an unstable state of consciousness. And any unstable state will always move towards a more stable state. And that process is what leads to the healing of anxiety or depression. So your emotional suffering is already on a path of healing that is built in to its very structure, its very essence. The problem is that we interrupt that natural process of healing through our unconscious reactivity. So think of an emotion like anxiety, depression, anger, guilt, whatever it might be, as being like a wound. The moment that the body experiences a wound, it immediately starts on a process of healing, quite naturally, quite spontaneously, and in a very intelligent direction. It does all that is necessary to promote the healing of that wound. It's exactly the same for the mind. All emotional suffering is destined to heal. Once it's created, it starts on that path of healing. But the reactivity gets in the way of that healing. In the same way as if we don't take care of a wound, if we don't bandage it, or if we don't treat it carefully, then that opens up the wound and gets it infected, and the wound doesn't heal. It's the same thing. So learning to be present with our emotions without reacting is incredibly important. It's the primary ingredient that allows healing. But when we start to explore the structure, the reactive thoughts that feed the anxiety or depression, the reactive behaviors that feed it, the secondary emotional reactions that get triggered, that feed the emotion, or the internal imagery that provides structure to the emotion. The more we see of all of this, the more we make it conscious, the freer we become from those unconscious patterns of reactivity, and the more that the emotion is able to heal itself. The more you see, the more it heals. But when we see reactive thinking, for example, we can intervene. We can see the thoughts very clearly. There is a reactive thought, and I choose not to unconsciously indulge in that reactive thought. If we see an emotional reaction to anger, for example, it might be sadness or a feeling of helplessness, we can respond to that emotion with mindfulness in the same way. I see that emotion. I choose not to become sad or afraid or whatever the secondary emotional reaction is. I choose not to do that. Instead, I choose to embrace that emotion consciously. It's like putting a space around the emotion. And if you think of an emotion as being like a fire, putting a space around a fire is a very skillful way of preventing that fire from growing. So this is part of the mindfulness training, seeing every aspect of it, and then seeing if we can become mindful of that aspect, seeing the imagery of the emotion. How big is it? How large is it? Many emotions that are very intense are very large. That's how we see them. That's what makes them very intense. That's part of the conditioned imagery of the emotion. Well, make it smaller. It's very simple. Try making the imagery of the emotion smaller. See if that helps. Change the position of the image. Many people see the emotion in their throat or their chest or their stomach, or sometimes just in the mind. That's its habitual position as part of its conditioned imagery. We can change its position. We can take it out of the throat and we can put it in a better position that helps it heal. Being in the throat does not help it heal. Putting it in another position, which could be putting it on your lap, for example, in a comforting position that helps you to develop compassion towards that emotion, that can make a huge difference. So we start to interact skillfully with our emotions once we see the structure of the emotion. And this facilitates healing. If you'd like to learn more about mindfulness therapy and you are interested in Skype therapy sessions with me to help you heal your emotional suffering without using medications, then please do contact me. Medications may have a role, but it's really important that you understand that medications are not going to heal the underlying cause of your anxiety or depression or any other emotion. You have to address that psychologically. You have to work on changing the relationship that you have with your emotions. So if this interests you, please email me. It's no obligation. I'm happy to answer your questions. If you would like to actually get started with me and start seeing some dramatic improvements in your emotional well-being, then please email me and we can schedule Skype therapy at a time that works for you. I see people throughout the world. All you need is a good internet connection, and we can usually find a time when we are both available to do a Skype therapy session. It's very easy to get started. The effects of learning these mindfulness methods that I teach during the Skype therapy sessions are profound. You will see dramatic changes within the first few sessions with me. So please contact me if you would like to get started and schedule Skype therapy sessions with me. Thank you.